Hello everybody, welcome to our next module. In this module we're going to be talking about food and eating related behaviors as well as exercise. In terms of eating, I thought this quote was a perfect one to get us started with. The food you eat can either be the safest and most powerful form of medicine or the slowest form of poison. That really gives us a preview to where we're going to go from here. As I've had you do in some prior lectures, I'd like you to view a couple crash course videos about the digestive system before you move on, just to review the structures and functions at play here, as well as the different types of nutrients and other substances in what we eat are broken down to and how they affect the body's functioning. One thing I hope you gained from these videos is that all of the different types of nutrients are required to keep your body healthy and allow your body to do the types of processes and operations that are needed to keep you alive. I think it's important to understand this up front because some things, like fats, have sort of gotten a bad reputation and have come to be seen as something that we want to eliminate from our diets. But really, fats are essential and needed for our body to function properly. That is, as long as we're not taking in too much fat, which is a big problem related to our culture and the way we eat. There are a couple of exceptions, of course, in that trans fat raises bad cholesterol and lowers good cholesterol, while sugar is absolutely addictive and can lead to the body becoming less able to regulate blood sugar over time, which can essentially make the body into a toxic environment. There are some substances that we really need to focus on consuming. For example, the body cannot produce vitamin C nor omega-3 fatty acids, both of which are critical to our health, so our diets must include these. In addition, while carbohydrates are not always classified as being essential nutrients for humans, because we could get the energy we need just from fats and proteins if we have to, our brain absolutely requires carbohydrates, specifically glucose, because neurons can't break down fat. Some vitamins can be stored in our fat, like vitamins A and D, while others are water-soluble and flushed from our system every day, like vitamin C and the B vitamins, meaning we have to try to consume them on a daily basis for optimal health. Insulin is extremely important to our body's functioning. When the digestive system breaks down carbohydrates into glucose, the glucose circulates through the body and blood sugar levels rise. When this happens, certain cells in the pancreas are prompted to release insulin, which is a hormone that communicates with our cells, telling them to absorb the sugar that's available in the blood to use for energy or to store it for future use. As the cells absorb the sugar in the blood, then the overall blood sugar level starts to drop back down. Insulin is a key aspect of helping regulate blood sugar so that glucose is available on a regular basis for cells as they need it. However, when individuals are eating a lot of carbohydrates and sugars, especially simple ones, blood glucose levels rise up very rapidly or very frequently, which can lead the cells to quit responding to insulin's message that they need to absorb the blood sugar over time. So insulin is still there saying, okay cells, it's time to take some of this blood sugar and either use it or save it for later. But the cells quit reacting. Thus, more and more and more insulin has to be released for the cells to respond. This is essentially the process that leads to what we call insulin resistance. Eventually, the cells in the pancreas that are responsible for producing insulin kind of wear out because they're really having to overproduce insulin to try to get the cells to respond. So eventually insulin production will really significantly drop or eventually just stop altogether. And this is when people develop problems like diabetes, where they have to introduce insulin into their bodies from an external source in order to get the cells to respond to sugar that's present in the blood. Of course, diabetes is a hugely common problem in our society, with an estimated prevalence of diabetes worldwide at 415 million people affected. When we're eating a proper diet and when we're bringing in appropriate levels of all the different nutrients, we're allowing our body to function at its best capacity in light of whatever other factors might be present. However, when we're failing to bring in certain nutrients through our diet, or if we're bringing in way too much of certain types, then this can be really harmful for our body. Obesity, or being at a body mass index over 30 or above when comparing one's height to weight, carries a lot of added physical risks in addition to diabetes. Individuals who are obese have higher risk for cardiovascular disease, digestive diseases, and an overall higher risk for mortality or death. Obesity is second only to smoking in terms of behavioral predictors or controllable predictors of mortality. Research suggests that about 50% of the variance in obesity is related to genetic factors. This seems to represent a diathesis, which may include a tendency toward dysregulation of hormones and their interactions with the central nervous system. When considering other risk factors for obesity, we know that obesity is more prevalent among African Americans, Hispanic Americans, and other minority groups, and that obesity is higher among groups with lower socioeconomic status. However, these differences are not due to any kind of genetic or biological differences. Rather, this seems to be due to these groups having lower access to health care, engaging in less exercise, having less access to or perhaps less money available for healthier foods, and greater average stress. We also know that more men are overweight or obese in developed countries like ours, though this pattern is actually reversed in developing countries. While male and female bodies do operate slightly differently, especially in relation to interactions of the hormones and the way those affect the rest of the body's functioning, such as how much fat is stored and where, these gender differences also appear more related to contextual factors like behavioral and social differences rather than biological factors. Getting back to a genetic diathesis then, what sort of tendencies might be passed down through the generations in one's genetics that would affect weight? Basal metabolic rate is the rate at which your body burns energy to maintain basic bodily activities when the body is just at rest. This depends on several factors such as age and gender and how active you are. There's a hypothesis out there that we all have a genetically determined set point for weight and that our body actively tries to maintain this weight, almost like a thermostat, where if we start to weigh more than our body's set point, the body cranks up its metabolism and turns down hunger. And if we lose weight and when we fall under that set point, our body turns our metabolism down and increases appetite so that we gain weight. And there is some evidence that supports this idea. For example, during World War II, peaceful protesters who did not want to go to war were pretty much forcibly enrolled into a study of what happens when someone has a diet very low in calories. This study suggested that when individuals are starved, the body adjusts for this reduction in calories by turning metabolism way down. Most of the participants did not lose any more than 25% of their body weight, despite extremely limited caloric intake. In addition, when individuals try to diet and lose weight, they often succeed with some initial weight loss, but then find that they hit a plateau, so to speak, where the body just isn't losing any more, despite keeping up with the dietary restrictions. Here, the body is probably almost getting a double whammy of increased hunger and lower metabolism that ultimately may result in having an even higher body weight after dieting attempts than before. I have a link for an article here that you can read, which is very much anti the idea that people can have sustainable weight loss just from changing their eating habits alone for these very reasons. The set point of our bodies also seems to change metabolism and eating behaviors in the case of weight gain. In another study with, quote, volunteers in a prison setting, the participants were asked to eat very large amounts of calories, much more than they would normally eat, and they found that the participants increasingly found eating to be more and more unpleasant and more difficult. When these individuals got to the end of the weight gain phase, all of the prisoners cut down their food intake very dramatically. So set point seems to change our perception of hunger as well as metabolism to prevent any huge change in body weight up or down. One of the interesting findings from this last study, though, was that not all of the participants lost weight after the overeating phase. A couple of them had a lot of difficulty returning to their original weight, even when they returned back to their original eating habits. Thus, the body's mechanisms may prevent weight loss to a much stronger degree than weight gain, which is good in preventing death by starvation, but not so good when considering the prevalence of obesity and its related health consequences in our society. Of course, this increased flexibility on the gaining weight side may also serve a protective function when considered from an evolutionary perspective. It may make sense for the body to store a lot of fat during times of plenty when much food is available, so that the body can be better protected the next time a drought comes along or the next time food is limited. Of course, at least in modern developed countries, many people don't experience food insecurity, and so the storing of more and more fat continues on. Of course, I don't want to minimize the very serious issue of hunger and food insecurity among many people who do live in our country. When considering risk factors for being overweight or obese and the host of illnesses that can go along with that, one thing that's really important to recognize is the fact that hunger does not really occur in your stomach. Certainly, the stomach sends messages to the nervous system via a hormone based on how stretched out or how flat it is. The hormone level goes up prior to eating, stimulating a feeling of hunger, and goes down for a period of time after eating. However, hunger really happens in the nervous system. We know that two parts of the brain in particular, two areas of the hypothalamus, play an important role in hunger because of what happens when we stimulate those parts of the brain, or when they're lesioned or when they're surgically removed. One part of the hypothalamus plays a role in stimulating hunger. When it's surgically removed, this leads to self-starvation among animals, so we assume their sense of hunger or drive to eat is gone. Another area of the hypothalamus plays an important role in feelings of satiation or the desire to stop eating, as stimulation of this part of the brain causes us to stop eating, and removal of it leads to profound overeating. In addition, hormones, including cortisol, the stress recovery hormone, and female sex hormones seem to have an influence on the perception of hunger and on eating behaviors. However, some people seem to be less responsive to changes in the hormones that signal hunger or satiety. It's possible this tendency to become insensitive to such signals, which could lead to overeating, could be passed down in the genes, where the appetite and hunger are kept turned on at a higher level than would be warranted. Of course, the body and brain change in response to our behaviors in regard to eating as well. Hormone levels change in children who have anorexia nervosa, trying to tell the body that there's hunger and a need to eat. In children who are obese, hormones change to try to tell the body that there's already plenty of energy stored away. However, as I explained before, the body is less able to regulate blood sugar when we eat too much of it over a period of time. We also know that once fat cells develop, they never go away. While those fat cells can either grow or shrink, you can never eliminate it. Evidence suggests these fat cells may actually trigger the release of hormones to produce more and more fat cells, especially in children. So once a certain threshold of fat tissue is developed, which can be based on genetic tendencies and eating behaviors, there's sort of a propensity for the human body to continue to create new fat cells, creating a cycle that would be very challenging to overcome. Thus, our behavior can lead to biological changes that would make being overweight or obese more likely and to persist over time. So while genetic diatheses can be passed down to you, Patterns of eating behavior and chronic stress may also represent diatheses in that they can fundamentally affect how the body is functioning in regard to sense of hunger, eating, and weight. Given the risk of the myriad of health problems associated with being significantly overweight, it's obviously good to try to lose weight for some people. However, these fundamental changes in the digestive, endocrine, and nervous systems can make weight loss, especially sustained weight loss, difficult. When we think about how individuals try to lose weight or try to prevent weight gain, the first thing we think about is dieting. A successful weight loss is considered a 10% reduction of weight that is maintained for at least 1 year. When individuals who are overweight are able to have successful weight loss, that does lead to significantly improved outcomes for them. However, dieting attempts are typically very unsuccessful. Most people who are trying to lose weight focus on just reducing calorie intake. As explained already, this doesn't tend to be very effective because the body will react with increased hunger and decreased metabolism. In addition, many diets are just not good nutritionally and may focus on a style of eating, such as eating only one type of food, that makes it very difficult to stick with the diet over time. And some diets are so extreme they can actually be harmful and more problematic than being somewhat overweight. Also, we often eat because of reasons that are not associated with physical hunger or fulfilling the body's needs. Eating tastes good and also tends to feel good emotionally. This positive reinforcement can make people prone to eat when they're stressed out, tired, or bored in particular. We also have often been socialized to eat in certain circumstances, such as to celebrate an accomplishment, mourn a loved one, when we're ill, or otherwise need comfort. There's some research that when children are provided with comfort food in childhood, or given treats to help them cope with emotions, this predicts they are using eating for stress management in the future. When we eat for emotional reasons, then, obviously efforts to lose weight will be less likely to succeed over time unless we address the underlying emotional needs as well. And dieting makes us feel more stress and be more in need of comfort. Individuals who participated in the food restriction studies often had a lot of psychological and physical symptoms, like being very irritable, feeling more aggressive, feeling more apathetic, losing sexual interest, and being fatigued and lethargic. Many developed an obsession with food when they were being starved, and they actually maintained that obsession with food even after they returned to being able to eat as much as they wanted. In fact, many of those who were in the food restriction study gained more weight than they had lost, resulting in them being even heavier at the end of the study than they had been at the beginning, after they were able to return to normal eating. So the body-based mechanisms that protect us from starvation have an emotional component as well, in that such experiences also prompt us to quickly locate and consume food. However, these unfortunately can make weight loss that would be healthy more difficult. And these findings on forced starvation mirror research on dieting. Especially with diets that are more restrictive, individuals find themselves feeling stressed and focusing more and more on food than ever before. These are just the kinds of experiences that often prompt us to turn to eating for comfort. Many who diet find that they cannot sustain their weight loss over time, and many even find themselves weighing more after they return to their typical eating patterns than they did prior to the weight loss attempt. There are also other social factors that promote overeating and eating foods that are not ideal for healthy body weight and functioning. For example, people tend to prefer the taste of fat and protein and carbohydrates. Many businesses capitalize on our taste for certain types of food, but this easy access to such foods can push our eating habits out of whack, which feeds the reward centers of the brain and leads to the growth of new fat cells, which the body perpetuates over time. In addition, portion sizes have changed dramatically, where the size of a kid's Happy Meal is now the size an adult combo meal was decades ago. So much so that we have a difficult time even recognizing what a healthy portion size is. Again, fueling unhealthy choices and the resulting body changes that make weight loss difficult. Healthier foods also tend to be more expensive than junk food, and our society is just full of sources of stress. All of these things are probably interacting to fuel negative eating related behaviors, weight gain, and difficulty losing weight and keeping it off. So, given the benefits of sustained weight loss, but the various biological, psychological, and social factors that work against long term weight loss, how does one go about successfully losing weight? Research suggests that long term weight loss requires developing sound eating habits that can be sustained over time and engaging in regular physical exercise. Around 80% of people who were able to lose weight and maintain it over a long period of time noted that aerobic exercise was a big part of why they succeeded. There are obviously all different kinds of exercise. While some, such as jogging or swimming, require a great increase in oxygen consumption and work the cardiovascular system, others focus more on muscle strength and require increased oxygen for only a short period of time. Engagement in exercise allows you to have strength, endurance, and flexibility. And of course, exercise is beneficial in long-term weight control. It's important for weight control in part because of the ways the body overrides restricted eating and dieting, but also because it leads to a higher basal metabolic rate, where the body is burning more calories all the time, even when at rest. Regular engagement in exercise also seems to help people engage in more healthy behaviors because of its psychological benefits. For example, regular exercise improves mood and subjective well-being, so exercise can cut down on the perception of stress and also reduce things like stress-based eating. So there may be direct and indirect means by which exercise helps control weight. Of course, even outside of the benefits that come from exercise-fueled weight loss or weight maintenance, exercise also strengthens the cardiovascular system and leads to less cardiovascular disease, reduces the risk for cancer development, helps reduce the perception of chronic pain, and even reduces the chances of falls or broken bones in older age. Engaging in exercise can also help individuals cope with medical treatments that are distressing, such as chemotherapy, likely because of the effects it has on the endorphins and the neurotransmitters that affect mood and well-being. Even if someone is not going through a difficult medical treatment, exercise leads to decreased anxiety and depression, so much so that the effectiveness of physical activity may be about the same as cognitive therapy or even antidepressant drugs. Thus, the benefits of engaging in regular physical activity are not constrained to weight loss per se. Especially given that physical activity is simple, inexpensive, and can be done almost anywhere, and given the just amazing and extensive benefits it provides, this is something we certainly should be focusing on trying to increase for almost everyone, as long as we can minimize or address the few potential risks to exercise, such as the risk for injury, such as becoming overheated or overutilizing one particular part of the body, or overstressing a damaged cardiovascular system. And some people even seem to become sort of addicted to exercise. While there are some potential risks to exercise, no health professional would ever come to the conclusion that the potential risks of exercise outweigh the potential benefits unless there are very clear risk factors present, such as in the immediate aftermath of a heart attack. Thus, for those who've been cleared to engage in exercise, experts now recommend that people should accumulate about 30 minutes of moderate physical activity 5 times a week, or more vigorous activity for at least 20 minutes 3 times a week, along with strength training exercises. While the hazards of being very overweight are well recognized, sometimes I think our society fails to appreciate that thinnest is not best. In fact, there's a U-shaped relationship between body mass index and death rate. Having a body mass index of about 18 has about the same risk of death as having a body mass index of 32. So there is a health risk for being too thin, which certainly can be related to some of the steps that people take related to unhealthy attempts to lose weight and diet. There are also things that happen where the body is not functioning at its peak performance or ability once body weight gets too low, because again, we need things from food for our body to function effectively. Problems related to eating and dieting attempts can become so severe as to cause significant distress and impairment in life, to the extent they're considered psychological disorders outlined in the DSM, the Diagnostic and Statistical Manual for Clinical Psychology. Eating disorders are very problematic emotionally, cognitively, and probably most concerningly, physically. For example, in anorexia nervosa, where the individual is often engaging in self-starvation behaviors, the thyroid function is slowed, which slows down metabolism. There can be irregular heart rhythm, irregular breathing, low blood pressure, brittle bones, dehydration, loss of muscle mass, and intolerance to cold temperatures. Most concerningly, obviously, is that individuals with anorexia even face the risk for starvation and death. In bulimia nervosa, where individuals are typically engaging alternately in binging and purging episodes, where they eat large amounts of calories in a very short period of time and then attempt to compensate for this through vomiting or using laxatives or excessive working out, these individuals face health risks like lack of energy, teeth damage, inflammation of the esophagus, and anemia, despite the fact that they often maintain a normal body weight. Most concerningly, individuals with bulimia can suffer from very severe electrolyte imbalances, which can make someone very ill or potentially be fatal, depending on how extreme it is. Similar to other medical and mental health problems, eating disorders can be understood from the diathesis stress model. For example, abnormalities in the serotonin system seem to represent a biological diathesis for these types of problems, while poor attachment in relationships and socialization to gender roles with a focus on a very particular type of ideal body weight and shape can be psychological and social diatheses. In fact, females and individuals who participate in ballet, gymnastics, modeling, swimming, and wrestling seem to be at higher risk for eating disorders than males or individuals who take part in other types of sports or activities. In countries outside the United States, where Western TV programming starts to be broadcast, the prevalence of eating disorders has spiked dramatically. Thus, biological factors seem to play a role, but don't capture the whole story of who's at risk for eating disorders. Treatment of eating disorders can be challenging because there's often a distortion of body image, which leads to little insight into the problem and little motivation to change. They may really resist or refuse any type of intervention until their physical issues and complications are so severe that medical intervention is forced upon them, things like forced feeding. The success of these treatments is very low in general. For example, for anorexia nervosa, research suggests that about 50% of anorexics do recover, with about 30% improving but struggling over the long term, and about 20% continuing with full-blown pathology. Even in those that do recover, however, there's a tendency to have high rates of relapse. Because of the factors that seem to interfere with treatment, interventions tend to focus on restoring physical safety, increasing insight and motivation to change, using medication to address any biological dysregulation, and or using cognitive and behavioral strategies to address potentially problematic thought processes, social patterns, and behavior. Again, thinnest is not best. So, for individuals who really could benefit from weight loss, how do we help them achieve it safely and successfully? There are certainly types of weight loss strategies that are medically based, like bariatric surgery, and this would be for individuals where weight has become so high it really is dangerous. However, weight loss or control for most individuals focuses on changes in behavior. Just as we've discussed in terms of other kinds of behavioral changes, The motivation, means, and support are needed for long-term success. In relation to trying to increase motivation for weight loss, again, we often have to help people overcome their optimistic bias in thinking they're not going to face the risks they know are associated with being overweight or obese. A health psychologist can help a patient focus on why they want to lose weight, the benefits they may gain, and how this relates to their personal values and priorities. For example, a patient I recently worked with was very motivated for weight loss because he wants to play with his kids more and live a longer life to see them grow up. This often involves helping them focus on the long-term outcomes and giving more weight to those than to the short-term consequences, which may tend to favor old behaviors. It can also help to make something like exercise more rewarding in and of itself by, for example, making it more fun or making it a group activity. In regard to the means to lose weight, we obviously have to provide information about the ways eating and activity need to be changed, which is best done on an individualized basis. Also, helping individuals set SMART goals, or goals that are specific, measurable, achievable, relevant, and time-bound, can be very helpful, as setting a goal that's unrealistic or too far ahead into the future may set someone up to be disappointed or feel like a failure or lose steam. Sometimes individuals who seek out either group or individual programs to assist with weight loss are able to get better success than individuals who try to do it on their own, and this may be because they learn behavioral means for changing behavior, which is a focus of a lot of these groups or individual programs. One aspect of these types of programs is stimulus control, where people look at their interactions with the environment and try to control the environment in ways that will minimize overeating or eating for reasons other than hunger. Limiting your exposure to situations in which you might be likely to fall back to old routines or habits, like going to certain restaurants or even buying certain things at the store, may help you be more likely to succeed in weight loss, for example. Using setting events can also set one up for success. Obviously, it might be easier to go work out with a friend than trying to motivate yourself to go on your own. And having good role models who can show you how to exercise and can help motivate you to exercise or to change your eating by seeing them can succeed can be great. Using reinforcements for progress and positive behavior change can also be very important. For example, making a trip to the nail salon contingent on making healthier choices, or treating yourself with a special experience, like going to a movie when you have avoided temptation, can be helpful. While people tend to feel an improved mood or feel better about themselves when they work out and thus experience natural reinforcers, sometimes external reinforcers can really be beneficial. Sometimes it can be helpful to get something like a reduction in your healthcare premiums or an award at your workplace for healthy engagement. We can also help people identify barriers and plan for how to address them. For example, an individual may not exercise if they don't have time to exercise, or feel uncomfortable in a gym setting, or don't know how to properly exercise, or don't have a babysitter, etc. Problem solving or problem-focused coping can be used to try to address these day-to-day barriers that may prevent successful change. Another aspect commonly included in these programs is a focus on increased self-control. For example, you can use mindfulness to consume your food with more awareness and avoid eating mindlessly. You can also intentionally eat more slowly to give your body a chance to feed back and tell you that you're full. When you practice self-control in one area, it will often transfer to others. Although one of the difficulties with self-control is that it does tend to be a limited resource that can be depleted when you stretch it too thin with too many demands. When you're trying to lose weight then, things that reinvigorate you like rest and relaxation and sleep become very important in maintaining your motivation. Relapse prevention planning is also really important. Recognizing that people do tend to go back to habits that they've had for a long period of time and helping them plan for what to do when that happens can be essential to staying on track. And of course, some people may need more intensive treatment, like cognitive behavioral therapy, where a trained professional helps them examine why they're eating, what they're telling themselves about eating, what they're telling themselves about weight, etc. For example, it would be no wonder that an individual may have weight-related problems if they strongly hold the belief that food is the only way they can manage their emotions, because they feel like that's the only thing they can turn to when they're feeling emotionally down or overwhelmed. I like this diagram as it's a proposal for the idea of stepped care for obesity, which means that the amount of difficulty that someone's having in managing their own weight is considered when determining what type of treatment to offer. The idea would be that for individuals who are slightly overweight, might be supported in working through self-help type programs where they're sort of given information and they try to implement it on their own with some amount of support. Whereas individuals who are more overweight, like 40 to 100% overweight, might be matched with hospital-based programs where they're seen by a nutritionist, in a support group, seen by their doctor regularly, given private counseling, or even put into a residential treatment program. Individuals who are morbidly obese, who try these steps without success, those might be the ones who are offered bariatric surgery, as we know that surgery comes with a lot of risks, and that the rate of gaining the weight back following surgery is actually quite high because behaviors have not changed. Shifting gears a bit, I do want to mention the wonderful ways that food can be used as medicine. For example, there are foods that have been proposed as being anti-inflammatory foods, with the suggestion that eating such food and avoiding foods that tend to bring about an inflammatory response can be very helpful to individuals with various health or even mental health complaints. There's a huge interest right now in whether food additives or aspects of diet may significantly contribute to symptoms of attention deficit hyperactivity disorder, with many parents trying to modify their children's diets to try to improve focus and decrease hyperactivity. In general, what we know about food and medicine in treating depression or ADHD or cancer at this point is extremely intriguing and exciting, though far from a point where we can make firm conclusions, as this article addresses. All right, please be sure you get on the module assignments and to our very interesting discussion, and please be in touch with any questions or concerns.